I'm Monica Bertagnolli, the director of the National Cancer Institute. I invite you to join us in the conversation that we'll have through these visioning workshops as we look to identify scientific opportunities and approaches that will accelerate progress for one of the most significant cancer challenges we face today. While cancer has touched everyone's life in some way or another, the unfortunate truth is that some groups of people still face major cancer health disparities, many of which stem from persistent structural barriers. To end cancer as we know it, we need to close these gaps for all people and to figure out how to prevent more cancers, to cure more cancers, and if this is not possible, to turn cancer into a livable, treatable disease. At NCI, we are dedicated to advancing cancer health equity and lead programs that study the underlying issues that contribute to worse outcomes for some groups, and also to identify approaches that address the specific needs of all people. Throughout our recent engagement with the cancer research community, we have learned a lot about what is still needed to address cancer health inequities. The more we learn, the more we recognize how incredibly complex this challenge is and how frustrating it can be for many who depend on scientific discoveries to find solutions that actually work for them. It is clear that it will take action by everyone across society to eliminate these inequities, and that we won't get there if we all just stick to what we're already doing. We have to find new ways to work together and take full advantage of everyone's collective resources, expertise, and experience. That is the spirit behind our new National Cancer Plan. The National Cancer Plan gives us a tool to help us focus so that we can all work together and eliminate roadblocks so that we can achieve the fastest possible results for everyone with cancer and for every type of cancer. These visioning workshops are a critical next step in this work. There is so much important ongoing work and progress being made to advance health equity. We believe that by bringing people together from many disciplines, as well as those who experience and understand structural barriers, we can learn from each other and find new ways to move forward. Everyone has something important to contribute. Whether you are from the research or care community, a cancer patient, a family caregiver, a health economist, an engineer, a data scientist, a community organizer, and so on. At these workshops, we would like to hear from you and hope to spur knowledge sharing and new collaborations that will help us to eliminate cancer inequities that so many people and communities still face. I'm excited to see what discussions and innovative new ideas you will have. And thank you all so much for joining this effort.